Hello everyone. Today we are going to discuss another set of one-liners in relation to pediatrics. To start with, angiokeratoma lipoma is present in which condition? Where will you get this condition? Pompe's disease, Markard's disease, Fabry's disease, or Farber disease? In which case will get angiokeratoma lipoma? The answer is Fabry's disease. As we know, Fabry's disease it starts in childhood. The clinical features could be decreased sweating, burning sensation, tingling, and prickling sensation in hands. We can get neuropathic pain. We can get various symptoms, GI symptoms like cramps, constipation, diarrhea, frequent bowel movements, all these. And the main classical finding is your angiokeratoma, where we'll get this angiokeratoma. The picture would be like this. This angiokeratoma will usually get lower abdomen and trunk area. So in Fabry's disease, we'll get angiokeratoma lipoma. Next, the preferred therapy for patients in convalescent stage of Kawasaki disease is, among these four, which one is the correct answer? Only aspirin. What we want to give in the convalescent stage of Kawasaki disease? Only aspirin, or aspirin plus IVIG, warfarin and aspirin, or aspirin or prednisolone? Which is the preferred treatment in the convalescent stage of Kawasaki disease? The answer is only aspirin. Kawasaki disease treatment, just to recall, acute stage we are giving IVIG 2 gram per kg plus aspirin 30 to 50 mg per kg. Moderate dose, we can give 80 to 100 mg per kg as high dose of aspirin during the acute stage. In convalescent phase, aspirin, the dose is 3 to 5 mg per kg if echo is normal. If coronary artery aneurysm associated with lung association is there, then long-term therapy with aspirin plus clopidogrel is ideal. So this is here during the convalescent phase we will give only aspirin. If coronary artery aneurysm is there, then we have to add clopidogrel along with aspirin. Next, Kobayashi score is used for, this is the tricky one-liner. Kobayashi score is used for, answer is Kawasaki disease. So this is the scoring. No need to remember all this scoring. Thus, just we can remember the Kobayashi scoring is used for Kawasaki disease. Here we can get, if point is more than or equal to 5, then risk of IVIG resistance is there. What are the points? Your ALT level, platelet level, CRP, age, sodium, neutrophil count, and duration of disease. All these points, if we add, then if the score is more than 5, more than or equal to 5, then we can predict that there could be risk of IVIG resistance in this case. Next, 12-year-old newborn presented with vomiting after ABF reading. On examination, what we are getting? We are getting scaphoid abdomen with positive bowel movements. Birth weight is 2.6 kg. Apgar score 8 and 9 at 1 and 5 minutes respectively. Antenatal record shows history of polyhydramnios. Which of the following is a true statement? So from this, what is the disease? On examination, we are getting scaphoid abdomen. We are getting positive bowel movements. So it could be a case of CDS. So among these four, which one is the correct answer? This condition occurs due to intrauterine vascular events causing segmental bowel infection. Is it true or false? Immediate surgical intervention is advised in CDH. Whether we want to go for immediate surgical intervention? No. Most common genetic association is down. This is the true answer. And antenatal diagnosis is not possible usually, but we know antenatal diagnosis is possible in case of CDH. So here the correct answer is the third one, that is most common genetic association is Down syndrome. Next, a 6-month-old baby presented with a history of stridor since birth. Mother notices the baby is feeding and growing well. The sound, that is the stridor, is not related to position of the baby. What is the most likely diagnosis? From a look itself, if we are in a hurry, we can say this is a case of laryngomalacia. Among these four options, croup, laryngomalacia, subglottic stenosis, and epiglottitis. Here we can say laryngomalacia from if we if you don't if you don't read this stuff, this question correctly, then this our answer could be laryngomalacia. But here what is the tricky point is, this is not related to the position. The stridor is not related to the position of the baby. That is important. So here the answer is your subglottic stenosis. Subglottic stenosis, stridor since birth you are getting, then this could be laryngeal anomaly. Mostly two types. If postural variation there, then that is laryngomalacia. If it is not related to posture, no postural variation, then that is subglottic stenosis. Next, delayed dentition is when no teeth erupts by, what is the cutoff months when we can say this is delayed dentition? The answer is 13 months. We know primary teeth and secondary teeth. Your primary teeth begins at 6 to 7 months. Your first tooth to erupt is your lower central incisor, but first secondary teeth to erupt is your first molar tooth. Total number of primary teeth is 20, but secondary teeth 28 to 32. Last tooth to erupt is your second molar. Second primary teeth is your second molar, but secondary teeth is your third molar. So if there is no dentition by 13 months, we can say there is a delayed dentition. We have to investigate accordingly. Next, Silence classification is used for what? Just a one-liner. We can remember Silence classification is used for osteogenesis imperfecta. These are the features, mild. These are the classification 1, 2, 3, 4. 1 is your mild form of osteogenesis imperfecta. 2 is lethal. 3 is severe deforming type, and 4 is your intermediate. Here we can just mark first 1 and 2 they are having blue sclera, 3 and 4 they are having number sclera. So Silence classification is used for osteogenesis imperfecta. Next, newborn baby having defects shown in the picture. Which drug mother might have taken during pregnancy? Is it lithium, carbimazole, valproic acid, or warfarin? What we can see, this is the aplasia cutis congenita. Aplasia cutis congenita, the drug is your carbimazole. If mother has taken lithium, then the degenerative expected is your Epstein anomaly. If mother has taken antenatally warfarin, then we can get bleeding and hypoplastic nose in the newborn. If mother has taken carbimazole, then aplasia cutis, and we can get also choanal atresia in a newborn. Carbamazepine is associated with your neural tube defects in newborn. Thalidomide, we know this is associated with your pocomelia. Vitamin D intake during high dose of vitamin D during pregnancy, we can get hypercalcemia in the newborn. Next, reflex shown in the picture appears at what age? What is this reflex? This is the palmar gasp. So when this reflex appears, is it 20 weeks, 25 weeks, 30 weeks, or 34 weeks? The answer is 25 weeks. Next, inheritance shown in the picture, seen in which condition will get among these four will that get this Mendelian inheritance? As we can observe, only there is male to male transmission. So this is a Y-linked disease. So among these four, which one is Y-linked? Is it neurofibromatosis? Is it MELA? Is it wave 2 or X-linked hypophosphatemia rickets? The answer is your wave 2. Thank you. Please like this video, share this video, and subscribe to my channel. Thank you.